neuropsychologist, and I'm also the designated CBSE counselor for India, and I deal with counseling and psychotherapy of students. About stress in women. So it has been seen that since the turn of the century, the status of women in India has been changing due to industrialization, urbanization, globalization, social legislation, and with the spread of education and awareness, women have shifted from kitchen to a higher level of professional activities and excellence. And this is creating the stress in many women who handle the role of a housemaker, who handle the role of a housewife, a mother, an employed woman, all at the same time. And who are the ones who are most affected? Women aging from 22 years to about 55 years are the most affected, are the most stressed, and they're struggling hard to balance their home lives with their work lives, with their professional hobbies. There's an outdated family structure, there are nuclear families, and all this is having an effect on the life of Indian women. And there's a research which has been conducted which says that women today who are working are getting up as early as 4:30 a.m. in the morning, and they're preparing breakfast and they're preparing the lunch for the children, and if they are aged parents in the house, they're doing their course, and then they go to the work and work whole day long there. Then they come back home and they do the remaining course of the dinner and the remaining work left. That is the reason of stress in women today. They said that 1 in every 4 women has been found out to be stressed by the various questionnaires that they undertook. And according to another survey, India is said to be the leading nation which contributes to stress in women. It's a very sad fact. 87% of these women who were interviewed, they said that they were stressed most of the time, and most of them also said that they did not find any time to relax or for their personal activities. So the reason behind all this for women is, of course, that they have to play different roles. We've been discussing that in the seminar which we had in the morning. They have their home to look after, and they have their home work to look after, and other activities, and then of course personal choices, personal hobbies. Many studies have produced evidence that indicate that women are reporting to psychological distress more than men, in the form of fatigue, irritability, headaches and depression. And women are more likely than men to cope with job stress. They are not able to cope with the job stress because of certain unhealthy habits which most of the women have. They don't eat well and they don't eat in time. They cater to the needs of the family and then they eat the remaining bit, or they sleep hungry. So they have unhealthy eating habits, and that's contributing to the stress. And of course, as I just said, just the causes of this workplace stress, I just enumerated it. So responsibilities, works, friendship, family life, the remuneration, the problems are there. So the money differences are there. That is leading to their disparity in their pays. And full-time working women have been shown to, in certain private areas, to have 17% less of pay in a week than men's. So that also contributes to their stress. And of course, there's a lot of job satisfaction going around also, to which they cannot address because they don't have the time or the means or anyone to talk to, or they don't know how to do it. So that is the topic today, stress, how to cope with it. So other than that, there's mental stress, and depression is very much there in women today, working women today. And the WHO has said that this depression is an epidemic which has spread world over. And this depression, which has spread world over, is an epidemic, and it has been said that it's 5 times more women than men are going to be affected by it in the next few years. So most of the women are stressed. There is career-related stress because they have their own problems there, which they are not able to. Be aware, press for a change, press to progress, press for equality, press for pay equality and gender equality. Right? Right. So this is stress. So that was just a gist to you about women in particular, but stress is something which is inflicting all of us today. So now I'm going to just talk to you generally about something about stress, which all of you should be aware of. So what is stress? Stress is a reaction to harmful, it's our body's reaction to harmful situations, whether they are real or perceived. So whenever you feel threatened, a chemical reaction, right? Adrenaline, it occurs in your body, and this release allows you to act in a certain way to prevent yourself from injury. What I mean to say is this fight or flight reaction is known as the stress response to something which is threatening you, feel is something which is threatening you. And during this stress response, the heart rate increases, you become more active, your blood pressure increases, and you take immediate action to prevent yourself from injury. This, telling you about something about stress. So stress is something in the mind. It has to be very clear. And it depends on the way you are thinking. Depends a lot on the way you are thinking. And it is in the form of anger, depression, suppression, irritation. All that is a form of stress in you. Then I'm talking of a stressor, a problem, a challenge, which is outside you. So be very clear on that. Stress is inside you, the stressor is outside you. It can be in any form. It can be an angry boss, it can be work pressure, it can be home problems, it can be an exam, anything, a stressor. And what is that which connects a stressor to the stress in your mind? It's your thoughts. So this is the connecting bridge or the link. How much you think, what you think, how often you think, your thoughts are what matters today. So we have this NGO, Pari Foundation, of which I am the director founder, and we are taking this awareness to all the colleges, because stress is there in all the students in one way or the another, and when they are not able to cope up with it, they are going into maladaptive coping and drinking and addictions. So as I said, this slide which I was telling you about, you prepare yourself, the fight and the flight hormone, so you prepare yourself for something which is you are being endangered with, and you take action. So this is good stress. This is good stress. In small doses, stress can help you to prevent yourself from something which is threatening you. For example, you suddenly slam on your brakes of your car when you feel you're going to get an accident done. So that is good stress, and our bodies are made in such a way that we can handle that stress. It's known as eustress or good stress. Right? But today I want to taking up distress. So when this eustress goes over the cliff, you land up with distress, and you're not able to cope up with that problem again. So this is a long term, this is chronic stress, and it has a lot of complications and consequences. Right? And of course technology has added on to all this stress. Right? So of course these are the symptoms of stress. You have the emotional symptoms, you have the physical symptoms, you have the cognitive symptoms, you have the behavioral symptoms, and I've all sort of enumerated them here. You have body symptoms like headaches, you have the psychosomatic problems, In medicine, a whole lot of psychosomatic illnesses, the physical illnesses, the headaches, the body aches, the repeated skin infections, breathlessness, asthma, fatigue, body problems due to stress. So you're giving them treatment with medicines. Symptoms may be subside, but if the stress factor is still there, the symptoms won't go away because they are stress-induced, psychosomatic. So the other factors are the emotional factors. So if anybody is very irritable or very angry or very, it's shouting at you, remember that he's in stress. That's what I tell my children. So when they come up with he screamed at me or he shouted at me, so you just that moment pause and tell yourself that that person is in stress. You don't have to go into stress, just be calm. So anxiety, depression, apathy, lack of confidence, lack of self-esteem, all signs of stress in you. Other are the behavioral problems, which will show up in the form of smoking, or you can go into addictions, or you'll be restless, or there'll be loss of weight, or there'll be too much of eating, or too much of sleeping, or very less of eating, or very less of sleeping, and so many more problems will come up. And you have the mind, the cognitive problems in the mind. So imagine, lack of concentration, lack of attention, lack of memory, and negligence, and making stupid mistakes, indecisions, impaired judgment. All these are characteristic signs that something is wrong with you. You are in stress, and as I said, the stress is in your mind. So you have to be aware and you have to take care, and that's so empowering because you can do it. Because it's just the way you think that you have to change. So those were the symptoms I told you. But if the stress continues and you're facing it and you're not doing anything about it because you don't know what to do about it. So that is why we come into the picture to tell you that yes, you have to be aware and take care. So these long-term consequences, they come to you in the form of mental illnesses. You go into depression, you go into anxiety, you go have personality disorders, you have psychiatric problems, you have bipolar, you have schizophrenias, you have cardiovascular diseases, heart attacks, strokes, obesity, eating disorders, you have menstrual problems, you have loss of sexual dysfunction, you're not interested in any men or women, or you have premature ejaculation, skin eruptions, and you have these hair problems, baldness, acne, psoriasis, eczema, anything, name it. Gastroenteritis problem, ulcerative colitis, something very much linked to stress, chronic stress, infected colon, long-term consequences. we are harboring it in our minds. And we are garnishing it and making it flourish with our wrong thinking. So what do you have to do? You have to be calm. That's what we tell each other. Be calm, don't stress. But how do you go about it? Nobody tells you how to do it. So that is why work, that is what we are taking up to the masses. So I tell them, I being a doctor, I believe in prevention is better than cure. So they say stress is preventable. Of course it's preventable. Why? It's because it's a state of the mind and it's a psychological state of mind which can be prevented provided you think positively, you learn how to cope adaptively with all your problems. If you know the solutions to your problems and if you're thinking positively, you're not going to be stressed. There's nothing negative going to come there. And do not allow negative thoughts to overwhelm you. Prevent being in stress. But how else do you prevent it? As I said, think positively. Learn to accept situations. It's a big question. Learn to accept situations. Acceptance is the need of the hour. We are not doing it. We are fighting with problems. We are fighting with challenges. So learn to accept, because you accept something which has already happened. And something which has happened is the past and you have no control over it. Right? So the moment somebody yells at you or you fail in an exam and you accept it and be in the present that okay, it's happened. You're stress free. Because then with a calm mind you are going to go into the future and plan. Then plan for the next thing. Then with a stable mind you plan for your next move. What next now? Do you get what I'm telling you? The next thing is be resilient. Build up your emotional intelligence. Be strong. Be emotionally strong. Be in high self-esteem. These are all topics which you should know about. Think of your strengths, of your successes. Don't think of your past failures. Think of what you have achieved. And you've achieved a lot if you just think about it. But we always talk about something we haven't achieved. We failed or something bad has happened. So don't talk about that. Don't blame yourself. Please don't blame yourself. Don't go in guilt. We are always doing that. 24/7. I should have done this better. I did this way. Don't learn to cope adaptively with your problem. It's possible. Don't go into maladaptive coping. Be adaptive to situations. Learn to adjust. Be flexible in your behavior. Learn to communicate well. Talk of your problem. Only then will you know the solutions. Understand the other person's perspective. Because everybody has a perspective different from you. So you are talking through your perspective, but try to understand what the other person tells you. And this is communication. And this is what we were talking in the seminar today up there. Communicate. Communicate means, it doesn't mean that I am right and you are wrong. That is ego. That is argument. That is communication gone. Communication is that I am right from my perspective and you are equally right from your perspective. The moment you learn this, you are a winner. Next, concentrate on positive results. This is being positive. Think positively means think of a result which is going to be positive. Don't say if I fail, if this happens, say no, I'm going to pass and this, I'll do this then. So train your way to think positively. Familiarize yourself, and of course this is something which we do tell, but I still don't, address to think positive, but sometimes we tell, okay, stretch the rubber band, think maximum worst that can happen. And then find a solution to it and then say, okay, is something lesser worse than this is going to happen. So then you are prepared for the worst, so nothing, you cannot ever go into stress. And finally, focus on solutions. We don't do that. We are talking of problems. We have been talking them right in the morning also. So don't talk of problems. Identify the problem, time over, finished. So there is a little bit of good news also, that other than preventing stress, if you get stressed, you can still manage it. So it's preventable and it's manageable as well. You have to recognize the symptoms of stress which I told you, and then you have to manage it. And manage it means from distress, you have to move to de-stressing yourself. And Stone gave us some words of wisdom. She said that remember that stress is not so much what happens to you, it is how you respond to the situation. So stress management techniques are there. There's relaxation, there's hypnosis, there's meditation, there is progressive muscle relaxation, there's mindfulness. When you're breathing, be in the present and concentrate on your breathing. Take in your breath, retain it and leave it. Do it for about 5 minutes. Mindfulness breathing, it alleviates your stress. Regular exercise, good humor. Of course, have your me time, some time for yourself. a regular balanced diet, and a good hours, 7 to 8 hours of sleep in the night, all manages the stress which you are having. So, my topic was no